Mariella?
We are ready to start the meeting.
Okay, great, thank you. Good evening, everyone, and welcome to this evening's Douglas County Board of Health. Today is Thursday, June 13th, 2024, and it is now 5:06 p.m. Would you all please stand and join us in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. President Doug Benevento is in a traffic jam, so in the interest of time, we're going to start the meeting, and when he gets here, we will turn the gavel back over to him. So thank you and welcome for being here. Mr. Pratt, do we have certification for everything on today's agenda?
Good afternoon, Commissioners. Chris Pratt with the County Attorney's Office. All of the items on today's agenda have been reviewed by the Office of the County Attorney and meet legal approval. You have jurisdiction to move forward with this meeting.
Thank you, Mr. Pratt. Do any members have any disclosures for items on tonight's agenda?
No, ma'am.
No, ma'am.
I have none. Have we heard from Kim Miramoto? Will she be here this evening?
No, she was in excused absence, and we weren't able to contact her alternate.
Okay, great. Thank you for letting us know about Ms. Miramoto. Okay, the next item on today's agenda is the consent agenda. Did everyone have a chance to review, first of all, the minutes for March 14th, 2024, and do I have a motion?
Please, the board, I do have a motion to approve items A through B of the consent agenda.
Second.
I have a first and second. All in favor say aye.
Aye.
Aye, and that motion carries. There is a quorum of the board present with 3 of the 5 members. Moving on to the regular agenda, the first item A is the executive director update. Mr. Hill.
I'll figure these things out by the time I retire. Maybe. Okay, so I'm going to try and go quickly because I know we have a presentation and there could be some time taken up with questions. A lot of things about meetings I've gone to and continue to go to on behalf of the county and the health department. Mr. Benevento had asked that I begin to include some disease information with each one of these, so I did comment that COVID cases were still low. There's nothing going on. Flu is over with pretty much for the year. There continues to be meningococcal disease at higher than expected rates in the country and in Colorado, but the fairly major outbreak that was happening in Denver amongst unhoused people earlier in the year seems to have kind of abated. We're also watching across the nation increasing syphilis cases, including in Colorado, so we're monitoring that. We being the epidemiologist, not me. But another thing I thought might be noteworthy is there's a lot of information in the news about H5N1 bird flu and being passed to people. So far being last week when I wrote this agenda, there had been 4 cases in the United States, 3 of those linked to cattle, none in Colorado. H5N1 has been identified in cattle on 4 farms in Colorado and in 1 cat on an additional farm, which they're investigating to see if it falls into this outbreak. They've been monitoring 113 farm workers in Colorado at the 4 farms with positive cattle. And to date, as of last week, none had developed symptoms, and the end of their incubation period is ending. So we're not totally out of this H5N1 thing, but it's not jumped to people in our state yet. Let's see, future plans. Continuing to work with the facilities department on potential relocation of the health department. And I know the commissioners have met on this, and there's various buildings being looked at, but it does appear that we may move the health department in the next few months once a location is found. I'll be attending the National Association of County and City Health Officials meeting in July in Detroit along with 5 of the staff. We have grant funding from the CDC for that travel for the staff. So that'll be a good opportunity for people to meet colleagues from all over the country. And I believe everyone who's going has never been to a conference like this before, so nice opportunity for folks, I think. I did want to highlight that the Vital Records Office Initially, when we set up this health department, I had projected to you that Vital Records would take in about $60,000 a year. In the last quarter, they took in $65,918. So we're running at about quadruple the projected revenue. And the initial projection was not just my being a bad projector, but based on the information I got from Tri-County. So great job there by the Vital Records clerks who are supervised by Bryn over there. And we've also promoted one of our clerks to be a grant accountant. So we've gone from having one accountant to now having an accountant and an accounting supervisor. So we've supercharged our abilities to deal with financial issues in the department, which is kind of needed because when we took on the Early Childhood Council, that ended up being a little bit more fiscal work than we had imagined. So, but there's enough money coming in to pay for additional effort there. So we're in good shape financially. I did also add a financial narrative report later in your agenda. It's there just as a written report. You can ask questions if you like, but trying to make sure that we don't just give you the numbers that were in the consent agenda, but someone will give you highlights of if there's something really noteworthy in there to point it out to you, and also make comments in general on how we're doing financially. So that's my report. I'm happy to take questions.
Thank you. Oh, I'm not on. Thank you. Apologize for being late.
It went on and back off.
Am I on now? There we go. Thanks. I apologize for being late. The clown show that is I-25 is reflective of transportation policy in Colorado.
Are you saying that CDOT doesn't fund roads?
Yeah.
That's what I thought you said.
Yeah, I think they fund congestion. Thank you. Director Hill, are there any questions?
I would just like to point out that I was sad to read that Caitlin Gupa has left, and I think that she did a great job and helped us get to where we are today.
I agree with you, Commissioner. And we did have a conversation today with the software vendor who poached Caitlin away from us and chastised him a little bit for that. And he's apologized, and we'll make sure nothing like that happens to us again. Not that we, want to hold Caitlin back from career growth, but, reaching into our organization and taking our employees, we didn't think was very nice. But yes, she did an excellent job.
The other thing I read, I have a list of notes after I read the packet, and this might not be in your report, it might have been in someone else's, about safe sleep for infants. As the coroner, I investigated cases of parents who fell asleep with their kids and then rolled on top of them and they died. And so when I read things like this, it's interesting that Sky Ridge and Parker Adventist don't have programs right now, but you're working with them and you're getting sleep sacks to do this. So I think that is a really positive thing, and it's something that the public can see that our health department is doing for our citizens. So thank you for doing that, Mike.
Okay. Are there any other questions or comments on any of the other reports? No?
I have none. I read them all.
Excellent. So we are going to the next presentation is the COVID-19 After Action Report. Dyko, I believe that you are up. And while he's getting ready, let me just make a few comments. First, the After Action Report was designed to do a few things. Primarily, it was designed to take a look at how the county responded to COVID, take a look at what worked, take a look at things that may not have worked, so that we could, capture the things we did well, look at the things that didn't go smoothly, and memorialize them, and hopefully leave a record for the future. And when I say things didn't go well, I think it's important to note, this is a once in 100-year event. At this level, is a once in 100-year event. To say something didn't go well isn't a negative reflection. It's a reality that when something happens once every 100 years, there's going to be a learning curve. the report is still being worked on. It's in really final draft form, but there are a few things that stand out, and I think Dyko's going to go through those, and I'll let him do that. But among the things that stood out for me was, and I think it's important to say this with the commissioners here, you were right, and the other folks were wrong. I took the opportunity to take a look at some of the press coverage that was going on when you all decided that, appropriately, that you wanted to leave Tri-County Health. And there were some histrionics around that, where where newspaper reports, I think, chastised commissioners personally, said that this was going to be a failure. And they were talking about, children literally gasping for air, gasping for air because of, seemingly because of your actions. And I think it's appropriate to stop for a moment. Nobody's going to print an editorial and say, gosh, you were right and we were wrong. But I think it's appropriate for us to note, and I think it's appropriate for Douglas County residents to hear, that you took responsible actions. You balanced the need between public health protection and the liberty and economic interests of Douglas County citizens, and you balanced them appropriately, and so that you could reach, and you did that based upon the facts. I've said this a couple times. I was in D.C. back at EPA when COVID hit, and I was, of course, the administrator runs the program, but I was really, for him, heading up our COVID response. And what we tried to do, and I think we did it as well as we could, but I think what you did very effectively is respond to facts as they came in. You didn't hear the first set of facts and say, this is what we need to do over the next year and a half or 2 years or 3 years. You took those set of facts, you internalized them, and then you kept looking for other facts and other indicators about how you should respond, and then you changed when change was necessary. So I think, one among the things, this wasn't the reason why we did the after-action report, but the outcome of the after-action report was to demonstrate that you did it right, and the folks that criticized you had it wrong. They held the pen at the time and still do, but you get to have, I think, the last factual say in the report that Dyko's about to present. So I just thought that warranted some notice. I'm going to turn it over to Dyko, if only y'all were in charge of I-25, I think things would be going better too. Thank you.
Thank you so much, President Benevento, and for the members of the Board of Health. This has been a really interesting project, and specifically from the perspective of Douglas County, and using the strategy of looking back to look forward and to make sure that the county is prepared for the next public health emergency or emergency in general. So I'll be brief in my overview. I'll go over some of the key findings and recommendations, and then be available to answer any questions you might have. So Integrated Solutions Consulting, we worked with the county project administration and planning team to conduct a comprehensive review of COVID-19 and its impact. This was a little bit unique in its study in that many of the after-action reviews that we've been a part of, and also that we reviewed as part of this project, we really kind of canvassed the landscape to determine what was being analyzed, what was being assessed, what were some of the lessons learned and strengths and focus areas that some of these other after-action reviews were prioritizing. And I would say this is one of the few studies, initiatives that really looked at it from a community-wide standpoint. Many of the after-action reviews really look at it from a public health standpoint, from a response standpoint to COVID-19 itself, so whether it's vaccination, testing, and so forth. This is one of the few studies out there that really looks at the entire community. So with that comes some challenges in that we're looking at a very long time frame of February 1st, 2020 to January 1st of 2023. So it's a long duration timeline. And then we're also looking at as many aspects of the community and the county that were affected by COVID-19. So it was certainly a large task, but very appreciative of those who participated and informed this study. So just briefly, in terms of the methodology, the report goes into greater detail but it included content analysis, interviews, group interviews, and questionnaires. Initially, as we approached this project and worked with the county administration and staff, the thought was we would be more survey questionnaire based, and so that was kind of the initial approach. But as we started to kind of work with the team and get to understand some of the issues and just some of the challenges with the timeline being February 1, 2020 to January 1st of 2023, we pivoted and found that the individual interviews and group interviews were actually going to be more informative, simply because it would allow us to probe and to take the time to really understand and help folks kind of recollect their experience with COVID-19. So a bit of a change in terms of our strategy, but I think ultimately it was the right approach, was to be more interview focused versus survey questionnaire focused. Because this is a community-wide study, we also wanted to engage and hear from those who are most affected, and specifically the businesses, the health and medical organizations, and nonprofit organizations. So as part of this, we identified the main entities that had a direct involvement during COVID. So we got feedback and had a very long, comprehensive questionnaire that touched on all three aspects: the nonprofit, community organization, health and medical, and business surveys. So we had 3 questionnaires that were distributed. As far as our questionnaire, we did canvass the entire county and utilized, for example, the Economic Development Council, the EDCs, to help promote and disseminate the survey. We utilized the county resources to identify the different community organizations and nonprofit organizations. Again, we prioritized those that certainly had a very important role. And then we also just did our own research and identified, I feel very confident in saying, almost all the different nonprofit organizations in Douglas County, and gave them an opportunity to provide input as well. So I share all that just so you kind of know what informed this analysis. The major threads throughout the report that really came through, severity was a really important metric that, certainly informed many of the policy decisions. As President Benevento mentioned, a lot of the data that the commissioners and elected officials had real time informed a lot of the decisions. And so we call out severity, and we'll speak to that here in just a few minutes. One thing that really stood out as well is just the can-do culture of Douglas County. And we kind of phrased and developed the terminology of the can-do culture. But besides severity and just the culture of Douglas County, the staff, and of the respective municipalities and the various organizations that really support everything that happens, the heartbeat of the county, that really came through. And again, my background, my experience, I worked COVID in many different places, just like many of you. And so to kind of identify what were those differentiators, what made Douglas County unique, that certainly was one of them. One of the major recommendations is, because of this can-do culture, because of the innovation and just the effort of supporting residents, businesses, organizations across the board, there were a lot of really innovative ideas and strategies that were implemented. What we did find, though, is a lot of that hasn't been codified or formalized or institutionalized. So one of the key findings of this study is really to take the time to formalize this in terms of planning, so that the next time something like this happens, we have a somewhat reflective playbook that can be utilized for emergencies. The other recommendation and just observation was just the need to reimagine public health preparedness in light of emerging threats and risks. And I'll speak to this a little bit briefly, but in the event something were to happen again, I think there'd be a proclivity to go back and dust off the COVID playbook. And the reality is, with the emerging threats and risks that we face, just we need to reimagine that. So especially in our continuity of operation plans and other planning preparedness documents, that becomes even more important. This kind of speaks to the issue of severity, but just the understanding and reality that all disasters are local. And to the commissioners' credit, that was something that really came through. And again, we'll speak to it when we speak to severity, is that a lot of the prescribed methods and ways to manage COVID were done kind of as a one-size-fits-all, and the reality is all disasters are local. So being able to adapt and provide relief and support in ways that really speak to the needs of the community, that really came through in our study and our interviews and surveys as well. And then lastly, I'll just touch on the essential elements of information. I think that's something across the board for public health. We recognize that data, especially when it comes to informing policy decisions, is more important than ever. And I think we all learned that having and identifying some of those key essential elements of information before the disaster, not during it and learning as we go, but identifying some of those key indicators beforehand and using that to inform policy and proactively determine necessary operations and interventions is really important. So I highlight that. The report itself is quite long and goes into a lot more. But in the interest of time and in the interest of the Board of Health, wanted to share some of those key points. When it comes to how the report is organized and some of the key topics that were addressed, as I mentioned, severity as a key metric is front and center because I think it really speaks to why Douglas County took the approach they did. We also go into the policies, executive orders, protective measures, the conclusions and also recommendations from that county-specific approach and initiatives. Within that, we also include some of the municipalities and some of their innovative approaches. Operational coordination, the health and medical component is very significant, especially with the formation of the new health department, fatality management, public information, community outreach, logistics and supply chain issues that many of the local businesses faced, and even from a county and municipal standpoint, some of the innovative techniques and lessons learned just from a supply chain standpoint are also addressed in the report. And then a big part of this is the community and business support and recovery. I think if I were to look at outside of the public health space, where did the county really thrive and really make a difference, it really came down to the way they provided those CARES funding and other mechanisms to support the local businesses and actually getting the resources into their specific hands so that they could survive and endure the challenges related to COVID-19. And then because of the nonprofit organizations and the many different organizations that were involved during COVID, we also have a section that addresses that specific aspect as well. So the report format is a little bit unique, not necessarily the traditional after-action report as prescribed by Homeland Security. We really wanted to take the opportunity to look back and identify COVID-19 specific recommendations. So within each of those categories that I addressed, we describe some of the occurrences and lessons learned, things that occurred, good or bad, that happened during COVID-19 as it pertains to each of those categories. And then a set of specific recommendations. And if appropriate, we did provide regional trends and analysis. It's not necessarily to say that Douglas County did better or worse than any other county. It was really there to kind of show a comparative analysis. So in order to kind of understand some of these numbers without offering some level of comparison, it's really hard to know, well, what do these numbers mean? So where appropriate, those regional trends are included. That includes some of the neighboring counties. And then per the direction of the county, we also included a section called Looking Forward, Preparing for the Next Public Health Emergency. And specifically there, it's more an opportunity to look forward and identify where are those gaps, what are those things that we still really don't understand or don't know. And so it's a set of recommendations for our state leaders and federal leaders for additional considerations and questions. So again, we wanted to be very intentional that this was based on the Douglas County experience. So based on the experience, the interviews, the data that we collected, we provided a set of questions for state and federal officials really to look forward. And it also speaks to one of the requests by the board the first time I was here, in that we really wanted to kind of look at what is some of the literature that exists right now. What are some of those key questions? What is it that we still don't know? And so that was our way of intentionally addressing that specific request. So one of the first issues I want to address is just on the topic of severity. It's one of those themes that throughout the entire report, it really underlies much of the decision-making, many of the difficult decisions and policy decisions that were made in Douglas County, not just at the county level, but also at the municipal level. And so I bring this up, and it's an important part of the report, simply because severity, it became very clear, was a very important factor in determining and prioritizing life safety, but also trying to find that proper balance between life-saving public health interventions and also ensuring the vitality and the survivability of the economy, the impact on our businesses, nonprofit organizations, residents, and especially some of the most vulnerable, including our school-age children. So this theme of severity is something that we address in the updated version of the report, which I believe the members of the board received. And so when we looked at severity, as opposed to just looking at cases or percent positivity rates with tests, which again relate back to more the cases and incident rate, looking at hospitalization, specifically ICU availability, bed availability, hospital surge status, ventilator usage and availability, and then deaths related to COVID-19. So when you look at some of the key factors that really inform severity, I'll show just a few slides and data points that many of our elected officials in Douglas County had access to and were being informed of, to demonstrate that ultimately severity was a really important consideration. So as it pertains to hospitalizations, in the report, we specifically call out the time period of December 2021 and January 2022, because at that point, there was the highest incidence of hospitalizations in the north central region, of which Douglas County is a part of. And this was a result of the Omicron surge, and across the board nationally, you can look at this time period being very, very challenging in terms of the number of cases. But in addition, the reason why we selected this is we also had, at that time, reduced staffing, especially in the healthcare sector. Hospitals were no longer prohibiting elective surgery. So in terms of hospital capacity, it wasn't just specifically dedicated to COVID. It was, everything kind of almost being reopened. So when you look at that specific time period, you would expect that there was a lot of demand on the healthcare system. And even during that period, ICU and medical surgical bed availability, even with all those factors, remained consistent at 10% availability. There were also a lot of other factors that we discuss in the report, just via the combined hospital transfer center system. Patients were coming into the north central region hospitals from outside the county. So just in terms of looking at the surge, and yet there's still level of availability, and recognizing that it wasn't just Douglas County residents that were hospitalized and utilizing the healthcare services. There were a lot of other factors. But we share all that because of the time period. This was one of the most challenging, and yet they were still able to manage a certain level of availability during this time period. Again, the comparisons are meant just to kind of provide some level of visualization, but during this time, there were regular briefings in terms of capacity, hospitalizations, and other data points, and so these were data points that were frequently monitored. Again, because of the Tri-County Health at the time being the prevalent public health department at the time, we resurrected and pulled some of the visualizations and reports that were provided to elected officials at the time to, again, share and show visualization in terms of hospitalizations during that long duration time period and where those peaks occurred. Again, you can see with hospitalizations during that December, January timeframe, where was the Omicron surge. When we also look at ventilator usage also as a metric of severity, During that same time period, one of the most high demand times for the region, during that 2-month time frame, ventilators were not a major concern. The region consistently had about 50% critical care ventilator availability at that time. So again, trying to just paint that picture of severity and just helping to kind of sensitize what informed some of the key policy decisions as Douglas County went through the COVID-19 period. Any fatality is not acceptable, so this is not to minimize or make light of any loss. My grandfather passed away during COVID, so it certainly is not something that I speak lightly of. But again, when we look at the data points, these were some of the key data metrics that were looked at regularly during COVID-19. To provide kind of more of a comparative mechanism, deaths per 100,000, because different populations differ across the region. Again, kind of looking at the overall time frame, and this is as of 11/2023. When you look at the county comparison, you can kind of see where Douglas County sits in terms of cumulative death rates. Certainly understand there's a lot of lessons learned and improvements in terms of how COVID-19 deaths are counted. That goes back to the essential elements of information. We just need to do a better job of counting and identifying key data metrics that can really inform accurately key policies, but share this as a metric of severity. Cases are important. Incident rates are important as well, and so I'm not trying to discount that, but when it comes to severity, those other elements were certainly important considerations, but obviously throughout COVID, cases were something that all public health officials and elected officials were reviewing constantly, and so again, just kind of showing a comparative mechanism, visualization for total cases in the region. So balancing those public health interventions and the livelihood of the community, trying to find that proper balance. I know that was a very, very difficult decision for a lot of elected officials and county municipal leaders throughout Douglas County. And so finding that balance and just trying to understand, well, what were some of the outcomes of that? And again, as I share these visuals, I'll be the first to acknowledge that there's a lot of different factors that inform the data. Douglas County is a thriving county. A lot of your efforts, investments, the people in this county are phenomenal. And so, again, the comparisons we show aren't necessarily to try to say that Douglas County is better, but again, it provides that visualization nonetheless. So with that, the dark blue at the bottom is unemployment rates from January 1, 2020 to January 1, 2023. That dark, thicker line is Douglas County. So overall, you'll see, and throughout the report, Douglas County did just as good comparatively, if not better, in many of these statistical markers. Again, a lot of factors inform this, not just COVID-19 or policies, but again, it's important to see some of these outcomes. When it comes to sales tax receipts for food services and drinking places, the peer-reviewed literature that we read, and I don't think you need a peer-reviewed article to tell you who was most impacted by COVID-19, but the restaurant and food service industry was significantly impacted. And so we wanted to find some data metrics to show over again that long duration period, January to 2020 to 2022 is where we had the data points. What was that variance? What was the level of variation? What impact did businesses, sales tax receipts in Douglas County face? And so you can see the variance is not quite as severe in Douglas County as perhaps other locations. And so, again, just wanted to share that data point. Safeguarding the well-being of the most vulnerable in Douglas County. Again, this is not to suggest that any loss of life or any hospitalization is certainly not something we want. But in terms of looking at it, especially with children and the impact COVID-19 had on certain age groups, we looked at hospitalization rate per 100,000 by age group for the Tri-County area. And you can see just based on these statistics, in terms of who was most impacted by COVID-19, certainly the literature indicates and the evidence shows that our elderly were significantly impacted. Those with comorbidities were certainly impacted with any underlying health conditions. And so when you look at some of these data points, it really shows that stark contrast of who was affected more than others. One of the metrics that was requested just to see what impact did COVID-19 have on our school-age children. Certainly, it was not an easy time for many children and adolescents. And so, again, a lot of different factors inform this, not just COVID-19 and its effects. So, again, want to be very transparent on that front. But, again, the statement of Douglas County did just as good, if not better, in many metrics holds true. So we looked at these different school districts and just kind of looking again at that time frame of 2018 to 2023 when it comes to some of the CMAS scoring. And this is, I believe, the reading and education, the reading attainment. Here you can see that where we're at now, we're actually better than we were pre-COVID. So that's a very encouraging marker. I know Douglas County scores one of the highest in the state of Colorado. So again, something that you would hope to see and that we actually do see. So again, a reflection of the county, the residents, and the investment they make in their education. This is the math scores. And so again, when you look at the math scores, better than pre-COVID times. So again, that's very encouraging. Again, a lot of data, a lot of variables inform this, but wanted to kind of show to the group just the impact certainly had on education, but in terms of the ability for the county to rebound and continue to support our children in that, it seems to trend in a very positive way. I'll move through these quickly here, but I'll maybe just focus on the ones that really are relevant to the Board of Health. One of the key outcomes of COVID-19 was just the formation of the Douglas County Health Department. I know that was a very difficult decision, a very contentious decision with a lot of input from the public and the media. But our conclusion as far as the health department is that when you look at historically the support that Douglas County residents received from the previous health department, a lot of them really kind of stem more toward the environmental services, not so much on the clinical side as compared to Adams and Arapahoe. So in terms of developing a organization that could really speak to all residents and all their needs, just in terms of preparation for the next pandemic, our conclusion certainly is that I think residents are better off and in a better position for the next pandemic or public health emergency by having a dedicated health department. One of the considerations and recommendations is as public health in general learns from COVID-19, modernizes, there's a lot of growth and a lot of evolvement that will happen naturally within the public health space. And then just balancing and meeting the needs of the day-to-day needs versus being able to surge and meet the demands of a community-wide emergency is going to be taxing for any public health department, let alone a new department. And one of those considerations and just realities is just across the board, when we looked at the literature and the analytics across the board for public health, recruiting and retaining qualified staff is actually going to be more challenging going forward as the market has become more competitive. There was considerable burnout with COVID-19, so a lot of very well-seasoned, experienced public health officials retired, moved on to other professions. So just in terms of recruitment and having a very qualified staff to position the county moving forward is going to be a challenge, but that's not a challenge unique to Douglas County alone. It's something that the entire industry is facing, but just wanted to kind of call that out as an important consideration and recommendation, observation going forward. I talked about the can-do culture. Many of the county staff, and this really came through in our interviews. They've served in leadership positions. They've been in their roles for a very long duration time. Those relationships were built. The trust was there. the culture of just coming together and innovating and identifying solutions to very difficult challenges. People put in positions that had no experience, managing a pandemic. Yet the staff across the board, not just in the county, but across the board in different municipalities as well, was very key and very obvious and a very common thread throughout all of our interviews. The recommendation going forward is just as we monitor employee retention across the board, retention level across the board seems to be lower, even a little bit in Douglas County, retirement trends, just the ability to retain, incentivize staff to stay and to kind of continue to cultivate this culture and maintain those relationships is going to be very, very important. And this might be one of those topics or findings that you might think, well, great, right? It's what is significant about this? But I will say, in my experience, having worked across the board in multiple communities, this was not something you saw across the board. And to me, outside of severity, if I were to pinpoint one theme that really, really stood out, it would be this. And so, the essential elements of information I talked to, and then just the ability to scale up and maintain continuity of services and operations. This is the last one I'll touch on. Just the importance of not just looking at COVID-19 and resurrecting that playbook, but looking at continuity of operations planning specifically in light of emerging threats and trends. One of the biggest concerns throughout COVID was because everyone was going virtual, if there were to be a simultaneous or intentional cyber element tied with that, it would have been devastating. And so just the idea of understanding and building future planning based on those emerging threats and considerations, and not just resurrecting the COVID-19 playbook for continuity planning is very important. And I'll just conclude by saying that just based on the preliminary findings in the draft report, the county is already moving forward with an action plan, have looked at a lot of these recommendations and is moving toward implementation. So this isn't one of those reports that's just a good story and tells the good and the bad and the recommendations, but it's actually being put into place, and there's actually been traction moving forward to better position the county for the next public health emergency or situation. So with that, thank you so much for your time, and I'll stand for any questions.
Thank you. I appreciate it. And could you run back a little bit? I'd like to go back to hospitalizations, if you would. And while you're doing that, I want to make a couple of comments as well. First, I don't think it was a difficult decision for the commissioners to either leave Tri-County Health or to make the decisions with respect to masking and public health orders. It wasn't an issue for the Board of Health. I don't want to speak for the commissioners. They can speak for them. I'm sure they will speak for themselves. But I don't think it was a difficult issue for the Board of Health to make those decisions, even when faced with lawsuits, and even when faced with negative media attention. And I want to read a little bit of that negative media attention because I think 3 years later it warrants some discussion. This was a Denver Post editorial in September of 2021 that reads, "Faced with a tough task telling parents and kids that for the good of the community they must wear masks in schools, Commissioner Layden and his fellow shells of public officials cowed to an angry mob that makes up a minority of voices in their sprawling suburban community. The commission voted to leave Tri-County Health because public health officials ordered that school districts require teachers, staff, and students to wear masks. This is a myopic and selfish decision born of an arrogance that makes people like Layden unable to fathom that suffering occurring abroad or even in southern states could happen in this community." Jump back to the slide just before this. I want to note that this slide does not reflect a massive level of suffering when compared with other counties. And look, COVID was tough. I'll be the first to admit that. But the decisions made in Douglas County were different than decisions made in other counties. And when you look at the level of hospitalizations in the county, it does not reflect a significant level of suffering, as this editorial would lead you to believe. And I wanted to point this out because, again, one of the aspects of this report that I think deserves at least attention, at least I'm going to give it some attention from my position on the Board of Health, that decisions were made appropriately by the county commissioners and the Board of Health, both with respect to leaving Tri-County Health and with respect to the masking policy. As you recall, we implemented a public health order on masking policies that said that parents get to make the call. Parents know whether their kids have a condition, and they can consult with their physicians, their healthcare providers, about whether their kid has a condition where that masking would exacerbate. That's what the public health order did. We were sued, and a stay was put on the order. I would like to note that when this editorial talks about minority voices in our sprawling community, the Board of Health or the Board of Education sued us. Subsequent election, the people who wanted to sue us, who wanted to maintain a masking order, were voted out. That doesn't reflect a minority of voices. That reflects a majority of voices that didn't like the policy that was coming from the Board of Education, and frankly did like the policy that was coming out of the Board of Health. Go to the next slide. I also want to reflect this slide. This slide does not demonstrate when compared with other counties, the level of suffering that some in the media wanted to claim would occur if we did what we did. By the way, I would note that the new Board of Education adopted our policy. And again, you're looking at, here we are looking at numbers. So I just want to again note that there's a lot to learn in this report, but one of the things to learn in this report is that you need to follow science, you need to follow facts, and you need to follow common sense. And in a crisis, you need to reflect you need to balance the public health interests of a community, which need to be considered, along with the liberty and economic interests of the community. You need to put those together, follow the facts, and come to a conclusion like the commissioners did and like this board did. And this demonstrates that we made decisions that were correct. Skip ahead a little bit to the educational aspects. Well, let's stop there. Go back. Let's go back. I just want to. This does reflect a level of suffering. Go back to the unemployment one. This does reflect a level of suffering. People are out of work. Being out of work reflects a level of suffering that is horrible, particularly with people who have mortgages and people who have families to support. And I'm sure during this time there was a level of suffering going on that that wasn't being reflected. Go to the next slide. So this also reflects a level of suffering because this impacts people who work on an hourly basis and work for tips, quite frankly. This is a pretty big level of suffering. I think, when we're talking about levels of suffering, I think we need to look at the levels of economic suffering that people that was occurring. Jump ahead to the next slide. Hospitalization rates, I think, tells the story I was just told. Jump to the next slide. This one is interesting, very interesting, and people can draw the conclusions they want from this. There's always a lot of what ifs that go into looking at this, but this is just a flat out reflection of data. If you look at the 2019 data and the 2023 data for CMAS scores, and this is data we have, by the way. Somebody who has a long memory is going to note that I have been a critic of CMAS testing, and they would appropriately say, you've been a critic of CMAS testing. Well, I was. But hey, look, this is the data we got, so this is the data we're going to look at. If you look at the 2019 data and the 2023 data, what you will note is that I believe Douglas County and one other county, it was maybe Boulder, have in 2023 exceeded the levels they were at in 2019. Everybody else is back at 2019, and Boulder's is basically flat, but they did increase. So this also reflects something, and it also reflects that the impact of policies on education. Keep going. This will reflect the same thing I just said. Keep going. All right, I think that's it. I just think that warranted some notice. I think that this report is going to tell us a lot of good things about what we need to do, and hopefully we'll never have another pandemic again or another emergency. But you don't develop public policy through HOPE. And hopefully this report will be useful to people in the future if they face something similar. But I hope it's also useful to people who write editorials, because if they had talked to us, if they had looked at why we were doing what we did, if they had talked to the commissioners about why they were leaving Tri-County, perhaps they would have written a different editorial. At a minimum, they should be writing an editorial right now that would reflect that the commissioners and the Board of Health made correct decisions during COVID. And, certainly none of us are perfect, but we did the best we could. And I think the best we could was okay. Anyway, I will take any comments or questions from any of my colleagues.
President Benevento, I would like to thank you for taking the time to go back in history, find these editorials, and reflect as you just did, slide by slide, on the report that DACO just provided to us. The end of Tri-County actually was talked about in 2019 when Dr. Douglas was at the Capitol saying he was testifying on behalf of Adams, Arapahoe, and Douglas County that we wanted a really extreme sex ed bill passed that talked about sex with second graders. And when the commissioners in 2019 heard that Dr. Douglas had done that, he was down here in Castle Rock the next day. And we put guardrails in place to prevent that from happening. But there were serious conversations in 2019 about leaving Tri-County Health because of the significant differences between Adams and Arapahoe counties and then Douglas County. And those were things that President Benevento pointed out in these slides. On July 7th of 2020, Dr. Douglas had told the commissioners in Douglas County that he was not going to recommend a masking order for Douglas County because of the science behind the numbers and the statistics. At that Board of Health meeting on July 7th of 2020, Julie Mullica, the representative from Adams County, made a motion to mask up all 3 counties, which was in direct opposition of what Dr. Douglas had indicated and had said on the record that day that he was recommending. That order passed, was it a 5-4 or a 4? It was a 4-3 order that order passed that Julie Mullica from Adams County made. There was the ability to opt out of that mask order. So on July 9th of 2020, Commissioners Partridge, Layden, and I met, and we voted 3-0 to opt out of that mask order. During that meeting, I made the motion that we leave Tri-County Health, that it was clear that Douglas County was different than Adams and Arapahoe County, and that motion passed on a 3-0 vote. And that's when on July 10th, the next day, then County Attorney Lance Ingalls sent a letter to Tri-County Health notifying them that they had a 1 year's notice that Douglas County was leaving and was going to create our own health department. There were bumps and jogs along the way, but we are here today, and I, for one, am very happy that we've made this journey, and I think our residents are much better off because of it. Thank you.
Thank you, Commissioner. Any other comments? Yes.
I would make one comment here, and there's somebody also that needs to be thanked for this. I know the commissioners took an awful chance in the political climate that it was pulling out of Tri-County. But also, we should thank Mr. Hill there because he brought the new health department to existence. And if we had failed, if we had stumbled, we would have had a lot worse editorials. And so, both to the commissioners and to Mr. Hill, I think we need to give them some applause.
Thank you, Mr. President. I obviously, I came to the Board of County Commissioners really halfway through the time period that DACO analyzed for us and his team analyzed for us. And the most striking part for me of the after-action review was that look forward and what the lessons learned could be applied moving forward. And I guess the reason why that's important for me is I came on the Board of County Commissioners halfway through the pandemic. And I was very fortunate in that my colleagues and my predecessor had done a great deal to lay the groundwork of what the actual pandemic response was going to be. We were nearly a year through it at the time. And so I really felt like I was coming on to something where we were managing the process. We were managing the community, given all the environmental constraints and the pandemic at the same time. And yet at the same token, it still felt, we were still in an emergency, and it felt that way. It was every week brought about a new means of analysis and asking, what can we be doing to make this better? And of course, my first 2 months were the 2 months of criticality that have been noted on so many of these slides. And so I look, in my detailed reading of the after action report, I couldn't help but go to what those lessons learned that we could apply moving forward. Because yes, this was a public health emergency. This was a pandemic. Quite frankly, emergency response is emergency response. We could have Plum Creek jumping its banks like what happened in 1965, in which case we probably we wouldn't be able to be here in this building. We would have to move. And so I appreciate the work done by ICS in terms of specifying those lessons that we could still do moving forward through all of our departments in order to ensure the continuity of operations of the county is still there. And then Mike, I couldn't help but read this after action review and reflect on a comment that you made during your interview. And I don't know, I've forgotten a lot of things from job interviews I've been through, but something you said really stuck with me, and you pointed out how you were kind of critical of some of your colleagues around the country for not taking the books off the shelf and opening them back up to talk about, to guide the response during a time of pandemic. I am strongly inclined that yes, this report is certainly going to land on several shelves when we finally do adopt it and publish it. But at the same token, I'm pretty committed to making sure that book comes down off the shelf when needed, if needed. Hopefully, it won't be needed again. Spanish flu, well, I'll remind ourselves, is over 100 years ago. But if so, I'm pretty committed to keeping up that can-do attitude here in Douglas County and making sure that as long as I'm a member of this board, and I would hope my colleagues on the board are with me in this, we will remain ready, and if the emergency comes, the emergency will be dealt with.
Thank you. Anybody else? Mr. Abe, thank you very much. Appreciate it. Wait a second. We haven't called for public comment yet. So, but I just want to, first, Mr. Abe, thank you very much. I know we're in the final stages of this. I think we're going to be done quickly, and I think the commissioners are going to get a peek at it next week at the final, or final draft, whatever we're calling it. Thank you. And let's stop here for a moment and let's go to, trying to decide whether we'll do public comment at the end of everything. Let's go ahead and do public comment on the after action report. We have one individual in the room. If you just come up and give your name and the town that you live in the county, I'd appreciate it.
John Fielding, Pinery. One question that I would have about the report is its use of hospitalization data. Well, if my memory serves, one of the things that came out was that hospitals had financial incentives to exaggerate COVID hospitalizations. The more hospitalizations they had that they could be traced to COVID, the more they stood to be reimbursed. And so this led to phenomena that got at least reported of people being hospitalized with COVID or dying from COVID. And in which case there's a distinction to be had. And I'm wondering if that affects the hospitalization data that's used in this report. And if, I mean, maybe it can't be adjusted for, but maybe this is something that should be looked at in terms of trying to refine the data, because really what we want to focus on are people who were hospitalized or who died because they had severe respiratory distress rather than being admitted for something else, and then they find that they're infected with the virus. So I don't know if this is something that the consultant can adjust for. Maybe the data doesn't allow it. But I think that certainly is a qualification for the data, and maybe the data should be adjusted to be a little bit more, present a more accurate picture. Thank you.
Thank you. Same if you provide your name and the town you live in.
Good evening, Fran Santagata from the Roxborough community. I wanted to really compliment DACO and Integrated Solutions on the thoroughness of the report and the way it was laid out. A lot of detail. What I will share with you is that I've read 3 separate national level after actions, one by Dr. Moravia, who is the Dean of the School of Public Health at Columbia in New York. Dr. Deborah Birx, that one was very, very telling. She was the chair of the COVID task force back in DC. And then Dr. Anthony Fauci presented at a event here in Denver. And, you know, they all hit on almost exactly the high points of what DACO presented to you today. One of the things that and Mr. Fielding just hit this, the data collection. So we are missing a national level surveillance system. That is the problem with going back. There's no way to go back. We started building a national surveillance system in 2006, and the funding was cut for it, so it never happened. So the way the data was collected all over the country was different depending on where you were. The point that you made about dying with COVID, dying from COVID became a hot point all over the country. And what all 3 of those experts said was, we need to create a system where that data is real time through electronic medical records, not the way we did it during the pandemic, which was very haphazard. And it caused a lot of consternation when you're trying to make these quick decisions, as you guys had to do in the midst of a lot of political turmoil, when the data is not clear. And so I would say, Mr. Hill, when you go back, one of the things to talk to our national representatives is about building this system before the next disaster that we have, because it's critical to making those decisions. The other thing that DACO mentioned was the staffing. And, you know, we have lost a lot of people due to attrition, due to how polarizing this whole thing became. And I think it's important to recognize who we have, and it's important to build a program where you've got some depth, because you're not going to be able to do just-in-time hiring. That's off the table. I will tell you that right now. We've lost a lot of our institutional knowledge. And so I would say to err on increasing your staffing so you can deal with this down the road, whether it's a pandemic or it's a rad nuke event or it's a large spill. Not having that capacity could hurt us in the long run. But again, thank you for allowing me to comment. Thank you, DACO, for a great job.
Thank you. Any other comment in the room? Are there any comments online?
Mr. President, no comments online at the moment.
Great. Let's move to the strategic plan update. Mr. Burnett?
Hi, my name is Chris Burnett. I'm with the Quality Improvement Department in the Health Department. I just wanted to go over the strategic plan update. July 14th last year, the Board of Health approved the strategic plan, and we agreed we were going to give quarterly updates as we go along. So this quarter, we had 4 main areas of focus within the strategic plans: behavioral health, promotion and prevention, disease management and prevention, injury prevention and internal processes. As of this date, we're current on all of our commitments that we made, and in most of them, we're exceeding the levels of commitments that we made. Behavioral health and promotion had a deadline of establish a working group of key stakeholders. They did that beginning in February, including both Advent Health and UC Health. Disease management and prevention had a yearly goal from a training standpoint to ensure they were 100% compliant with their training. They were at 80% when we started. They're currently at 100%. Injury prevention, we had a goal of getting meaningful data. Douglas County just received the latest coroner's report, so they're going through that now. We also are working with the Mental Health Initiative from an ARPA grant to do mental health first aid training, which will train people within the department and within the Mental Health Initiative to be trainers and go out into the department or go out into the community and be able to train on mental health and mental health guidelines. That's should occur at the end of the year or maybe the beginning of the year, but they will be trained and out in the community, serving the community with mental health training. We also had a goal within disease prevention of ensuring that our epidemiologists were out in the community, really serving the community and sharing any knowledge. We had a goal of 3 per quarter. We have exceeded that goal, and they're doing more than 3 per quarter. And I did want to take a moment to give special recognition to Matt Hughes, who's one of our epidemiologists. He was asked by a former professor at CSU to come up and give a lecture, which he did, which was fantastic. And then he also was asked by the Elizabeth High School to come and do a presentation on what an epidemiologist do. So I felt that was above and beyond and really getting out, and also from the discussion earlier of really working to build the workforce. That's one of the goals of, I know it's a later action item of accreditation, but really building that workforce and having the backfill and able to do that. And so by Matt taking the time to do that, it was really, I felt, appreciated. From an internal process standard, we will be giving quarterly updates on the strategic plan. As I said earlier, the strategic plan was adopted by the board on July 14th. We will be having a strategic plan revisit session in the first week of August. So it's planned now for August 6th, but we just need to make sure all the schedules are going to work. We'll be inviting the team that helped develop the strategic plan to look at where we are currently and decide if that's the spots where we need to be. So we will have that scheduled and completed before the next board meeting, which is, I think, August 13th. So we'll be able to report back on at least the pending changes and the idea of where we were successful with the strategic plan and where we need to tweak it. Mostly on everything we've been complete. The next strategic plan update for the third quarter is going to be very minimal. So we'll probably look to share more maybe on the workforce development plan and what we've been doing with that, because that is part of what the internal processes were, and we have been spending a lot of time working on having a recognition committee and trying to really work on the retention within the department and also professional development. So we will present that at the next Board of Health meeting. Any questions?
Eric, I'd just like to thank you for getting out into the community and working. I really like the idea with the mental health first aid that we're working with that we were able to secure a grant for, so thank you for that.
Any other? I just have a request, and it's certainly voluntary. I'd love to see the presentation that was given up at CSU on what an epidemiologist does. I think it would be interesting.
Yeah, I'd be happy to forward that to you. And
be
actually,
great.
Matt's here, so I would recognize him, that Matt came to the meeting, but I certainly have that information, and I consider it was.
I'd love to see it. I'd really like to take a look at it. I think it would be,
Yeah.
just share it with Director Hill, and let's put it in our board packet for the next meeting.
Certainly. Yeah, and I thought it was very good because it was tailored to each of the groups that he taught.
Yeah.
So it was very, we did a recognition newsletter that we just put out yesterday, and I put in there that it was not only the right thing to do, but it was really above and beyond, that he went out and really did that. So I really appreciate Matt's hard work on that.
No, that's a super great idea and great outreach. And so, yeah, let's make sure that gets in the board packet for the next meeting. Thank you.
You're welcome.
Any public comment on the strategic plan update? Is there any public comment online? I think that's a no. I'm going to go with that being a no. Okay, we're now going to move on to action items. Director Hill, I'm going to turn it over to you to introduce the action items. We'll take public comment after each of the respective action items.
Okay, so the first one here, every year we get allocations of funding from the state. Now it's two state agencies, early childhood and public health. Early childhood has been lagging in getting us any contracts, but we have $1.925301 million worth of contracts that we received from the state for their fiscal year starting July 1 that are in your packet that we're requesting that you approve our acceptance of. And if you have, I'm not going to go like list through each one, but if you have questions on any of them, we can answer them.
I do not. Are there any questions from board members?
And again, these are all programs that the Board of Health approved us performing, nothing new is being added.
Right, and this is for upcoming year act. This is stuff that you've been doing and you're getting a new allocation for it? What's the reason for the allocation at this point?
Well, the state's fiscal year ends on June 30, so their current year funding ends and they have to give us new contracts.
Okay.
It's
for the, so it's for the.
they're not
new-
even,
yeah.
most of them aren't even new contracts, they're just
Right.
option letters to extend the
Right,
contract.
right. Okay,
So I believe this is for $1,925,301.
Yes.
And it looks like there were various different grants that we would be getting. So I appreciate you bringing this forward because we need this money to operate the Board of Health.
We do, and I mean, I should note that the first item in there is our just money we get to be a good public health department, and that has doubled. The legislature voted more funding to CDBHE, so that funding for us doubled. So it's an additional $400,000 a fiscal year.
okay. Any other questions? Let's do this. I'm going to take public comment and then we'll go to a motion in a second and we'll have a vote. Is there anybody in the audience that would like to comment on the acceptance of these grants? Is there anybody online?
Nobody online, Mr. President.
Okay. Okay. I will take a motion in a second.
Mr. President, if it please the board, I do have a motion to approve the review of the state funding allocations received since March 2024.
I will second that.
Okay, we have a motion and we have a second. All in favor, say aye.
Aye.
Aye. Opposed? Okay. Mr. Burnett, you're back up again to talk about public health accreditation.
If I was a more linear thinker, I would have put both of his items together, but my brain doesn't work that
I
way.
need the steps, probably.
Well,
So-
reviews are coming up. We'll note that. Nonlinear thinking.
Once again, my name is Chris Burnett. I'm with the Quality Improvement Department at the Douglas County Health Department. I won't go through and read what I put in y'all's packets because I know you read everything. I just would mention a few extra things. In the after-action report that came through, there was some talk about how when Tri-County took over, there was not as much public trust in the health department. This is an excellent way to get public trust. Totally nationwide, there's about 3,500 local public health departments. Of those, 393 are accredited, so about 10%. In Colorado, we have 56 total public health departments, and 5 are accredited. If we were to get accredited, we would be the 6th, which would put us in kind of an elite category of really following all the national standards and really building the trust within our community and with our constituents. I feel like it's a real positive for a health department that's relatively new. Being able to look at what the national standards are and kind of go back and say, oh, we don't have that. This is something that we need. Is something that can really help build a solid foundation for the future and can really help us grow. So I feel like it would be a great thing for the citizens and also a great growth platform for the department to have those concepts and know this is the goals and this is where we want to get to. So I would ask your approval on this measure.
Thank you. Director Hill, is this an inducement to attracting employees?
I think that it could be, Mr. President. I'm not going to state that as a fact because I'm not sure anybody has examined it. When this accreditation process began many years ago, I was sitting in the room as a health director who still had hair, and part of the impetus then was that yes, it would be attractive to work at health departments that are accredited, and that it would attract more funding. And in some cases, it does work to attract funding because if you're going to give out money, you're going to give it to someone who has met national standards before you give it to just...
Yeah, I just have to believe, though, if you're looking to attract and staff, sort of the best staff, they're going to be looking for a health department that is the most credible and that has, that is recognized for being credible and for being professional. And so I think one of the advantages of this is clearly, and we did a little bit of this when I was at I dealt in this area a little bit when I was at the health department. Certainly there are a lot of benefits to accreditation. I don't think the least of those benefits is the reputation of the health department and the demonstrated excellence of the health department, and that helps. And I think we attract a pretty good quality of folks anyway. I think this will only help us attract the best quality of folks when you're hiring. So, any other questions? Oh, yes, Doctor.
I'll make one comment if I can. And I'll say this, that I am not in favor of accreditation just for the sake of putting a certificate on the wall. But in this particular case, given the fact we're a new health department, that there are national standards and very few people meet them, I can see advantages to this in personnel and also financially. So in this case, and that's an exception for me, I am in favor of accreditation.
Excellent. Is there any, Commissioner, do you have?
Yeah, let's go to public comment.
Yeah, public comment? Any public comment on this? Is there any public comment online? I think that's a no. I will then seek a motion in a second.
Well, Mr. President, I'd be pleased to make a motion to approve the request to pursue public health accreditation, and in the event of a second, would like to speak in favor of the motion.
Okay.
And I also would second this for the reasons which I have just stated.
Thank you.
I'd like to speak in favor of the motion specifically. I mean, in my professional career, prior to elected service, I did, golly, I can't even count how many accreditation processes I was either part of, either as an employee, a manager, or actually as a consultant with my clients when they were going through them. And I really appreciate what Dr. Fielding said, because I've been a part of those organizations that accreditation was the end of the means. I mean, it was there wasn't much of a point other than to hang a certificate on the wall. I support pursuing accreditation because I've been in the room and have partaken of going through the process and having those aha moments. And, for every aha moment, there's probably 100 other moments of, you're checking a box, if you will. But getting those aha moments and turning them into actual process within the organization, I've always found to be invaluable. And so, I really think, just as the doctor said, we're a new organization. This gives us an opportunity to learn and perform at a nationally certified level early. That, my experience says, that usually then becomes the norm going forward. And to your point, Mr. President, I don't know how many entry-level people will hire who are going to be enthralled with an accreditation in the department, but it's the management that seeks us out, and then Mike, you have to do the job interview with, or your assistant, your deputy directors have to do the interview with. It's those individuals who are coming in for management roles and who have that career goal and do want to be a part of an accreditation. And maybe we don't hang on to them for 20, 30 years like we're used to here in Douglas County with our employees. Maybe these are folks who are only going to come in for a couple of years. But to have those quality managers come in, be a part of the process, and then, probably go on to their next thing. By having that accreditation, that can make it a valuable experience for them as well as for us. So I do speak in favor of the motion, and I intend to vote yes.
We have a motion, we have a second. All in favor, say aye.
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 Aye. Opposed? Wonderful. And then we have Laura Larson up to talk about staff requests to develop a partnership with Northeast Colorado Health Department for WIC services. Ms. Larson, thank you.
Good evening, everybody. Laura Larson, Assistant Director for Community Health at the Health Department. In your packet, you do have a document entitled WIC Partnership Opportunity, and that's what I would like to review with you this evening. As you all are aware, the Special Supplemental Nutrition Program for Women, Infants, and Children, which we affectionately refer to as WIC, provides healthy foods, nutrition education, breastfeeding support, and access to resources to more than 2,200 pregnant women, postpartum women, breastfeeding women, infants, and children under the age of 5 in Douglas and Elbert County. Although our WIC program is not income generating, what it does do is provides positively to our economy when our families can go and take their eWIC card into one of 24 retail stores here in Douglas County that accepts WIC benefits to purchase their food, baby food, and formula. CDPHE has been in the process over the course of the last year of changing this service structure that we have within WIC as well as the funding formula. And part of the reason that they're looking to do that is to increase capacity of the program across the state of Colorado and also maximize budget efficiencies as we're looking to continue to grow the program as a state. With that said, in order for us to increase the amount of folks that we're serving in our program and really maximize the work that our team does, we're looking at an opportunity to partner with Northeast Colorado Health Department, which serves Logan, Morgan, Phillips, Sedgwick, Washington, and Yuma counties in the northeast corner of the state. You'll see here in this document there are some minimum service standards that are required for all WIC programs. That does include the role of the WIC director and the registered dietitian that provides high-risk counseling to families in the WIC program. Currently, Northeast Colorado has had a significant challenge in trying to fill those two positions, and they're operating the program right now in absence of those roles. We've been very fortunate here in Douglas County to have a great staffing model, very successful staff that are in their roles, and we've been able to execute those roles specifically very well. Where we've struggled is with our Medicaid verifications and our referral management system as we're getting referrals in for more families that need services.
Can I have just a question on that point. What does that mean when you say you've struggled with Medicaid verifications and for WIC families and referral? But what does that mean?
Absolutely, Mr. President. We're required, so as you all know, if you are on Medicaid, SNAP, or TANF, you automatically qualify for the WIC program. But part of what our team has to do is go through a process of verifying active Medicaid for those families. For many health departments, that's very easy. If they offer clinical services and they have an NPI number, they can get into the state's Medicaid portal to verify those eligible families electronically. We don't have clinical services. We do not have an NPI. And so we're having to pick up the phone and make phone calls to a Medicaid phone system. Sometimes it's an automated system that works really well, and we can get those Medicaid verifications done in a matter of minutes. Other times, we end up getting routed to a live person at HCPF to verify that Medicaid for us. That can take upwards of 20 minutes just to verify one family. It's not an efficient way for us to manage our program.
How many families do we have?
Right now, I just pulled numbers through May. We've served May of this year. We've served 2,200 individuals, roughly 1,700 families.
Okay. So that 20 minutes can take a bit of time. That's
for
multiplied
one
by
family?
1,700.
Absolutely. And we're doing anywhere between probably 50 and 100 Medicaid verifications per week. So there's a lot, because we're having to do that with every recertification appointment that we're taking a look at for families that need to recert on an annual basis. So it's just incredibly time consuming and cumbersome for our staff.
And so Northeast Colorado has the ability to more quickly verify folks, but they've had some difficulties, it sounds like, staffing wise. And so, and I'm sorry, I don't mean to jump to the, I process by sort of explaining back what I think I've heard. So what you're proposing is that we sort of have a marriage where they would do the verifications for us, because it's going to be more quickly, and we would assist them with staffing issues, but there would be a share of the cost, so we wouldn't, Douglas County residents wouldn't pay for Northeastern Colorado residents, and there may be a reason to do that, but that wouldn't be happening here. Our dollars would stay with us, their dollars would stay with them, and we had sort of an administrative structure that marries our weakness with their weakness and brings our strengths and uses their strengths. Is that right?
You summed that up beautifully, Mr. President. Thank you.
Oh.
Yes, so that really is, they've got the access because they provide clinical services. They can do that piece of the work more efficiently than we can. They can also help support the referrals that come in, and that comes in through the PEAK system. So PEAK, with Medicaid referrals, it's also coming in through the WIC referral system. They have dedicated staff that could help support us in that area while we're providing the administrative support with the WIC director and then the high-risk counseling with the registered dietitian. So we're looking at that. This is completely contingent on additional funding from CDPHE. What we would be looking to do is hire an additional registered dietitian that would be supporting. We would hire them. They would be housed and employed by Douglas County Health Department, but would be supporting the work of Northeast Colorado Health Department in that particular role. But that requires the additional funding support from CDPHE in order to execute that.
The funding, CDPHE would not need to approve of the structure we set up. They just have to provide the funding for it. Is that correct?
That is correct. The CDPHE is really encouraging local WIC agencies to partner together because, again, they want to maximize funding and they want to increase access. They've seen across the course of just the last 2.5, 3 years an increase of about 20,000 families that need WIC services, and that number continues to grow. But the only way we can do it and do it well is if we start creating partnerships with other local WIC agencies.
Okay. And there's no prohibition on sort of them using the database to serve us. We're good on. There's no there's no confidentiality, other problems that could arise from that.
No, there's nothing of concern on that. That would be something that would be included in a memorandum of understanding so that we can share that data, but we have the capacity to do that within WIC.
Okay. So all confidentiality stuff we wouldn't have to worry about.
Correct.
Okay.
Correct. So again, you'll see here in this document, it does talk about what that partnership would involve. So again, sharing responsibilities of the WIC director and the high-risk counselor, sharing the referral management and Medicaid eligibility, establishing clear communication channels and collaboration for effective teamwork and coordination between our two agencies, conducting regular evaluations and reviews to assess effectiveness of the program and the partnership, and pivoting where we may need to as we go, and then defining operational roles and responsibilities through that memorandum of understanding. So what we're asking this evening is twofold from you all: an approval to pursue the partnership if funding is approved from CDPHE, which we expect to hear back sometime probably mid to late July, early August, for an October 1 start date, as well as authorizing Mr. Hill to sign that memorandum of understanding for us.
When will you know about the funding, and when would the memorandum be prepared by?
So again, the funding we should know sometime mid to late July, early August. We would then execute that memorandum of understanding with an effective start date of October 1st.
So is this an action item for tonight, or is this an action item for our September meeting?
We're trying to get all our ducks in a row for the state.
So we're
that we're not
ducks,
at
you're
the
trying
last-
to get in a row.
Well, I would not call you ducks, but if you want to call yourself a duck, that's okay. No, we're just trying to get everything together, so if the state approves this, we're ready to pull the trigger and go.
Okay, fair enough, fair enough. I'm sorry, I feel I'm dominating the conversation. Are there any other questions?
When is Northern Colorado Health Department going to have their board review this, or have they already?
They have already had their board review and they approved as well moving forward.
So will this affect the delivery of services? Will they be done remotely, or how will that happen?
Certainly, that's a really great question as well, Commissioner. So when we're looking at that registered dietitian role specifically that would be supporting Northeast, that work would really be done remotely. Currently, the way WIC operates is we do have hybrid operations here in Colorado. Douglas County, we have really pushed to get as many of our families back in person as we can. It's incredibly helpful for us to have our eyes on those pregnant moms, provide that breastfeeding support, and really get our eyes on the kiddos as well. So as often as we can get families in person, that's what we aim to do. I would say probably 90% of our visits are done in person, and our families love it. They love coming back into our clinic locations, so that's been great. But in order to really help support Northeast, that's not a feasible option. We can't have somebody here in Douglas County that's going back and forth up to the northeastern part of the state. So we would do those visits, especially because they're high-risk counseling visits. Those can all be done remotely via phone. So that's a great way for us to be able to utilize that role, make sure that those families in the northeast part of the state are being served the way they need to without incurring additional costs with travel and things like that.
Thank you, Ms. Larson. I have no other
Absolutely.
questions.
One last question, and I'll call for public comment, then a vote. But okay, so it seems like what's going to happen is going to be increased efficiencies at the health department, correct? And I guess, maybe this is it's a comment, I guess, not really a question. So you're going to have increased efficiencies, and staff is going to be able to do more with their time. This is going to be an efficiency benefit to the department because now what you're having to do is taking a lot of time. It's going to take less time once that goes in, and so staff will then be able to do more with their time, correct?
They'll be able to do more with their time, and honestly, it's an opportunity for us to increase the number of families that we're serving because they're doing less of the administrative burden work that we have to do with those families.
Right, and I was just going to ask, you said, what is it, 20%, you're saying 20, 30% increases, you said, in WIC enrollment?
We've seen over the course of that
In
first year that we operated.
Douglas County, yeah.
For the first year. So when we look at where we started at the beginning of 2023, where we landed at the end,
Yeah.
and where we are right now, it's about a 20% increase over what was being done by Tri-County.
Okay, so we'll be providing better services to Douglas County residents because of this memorandum, this structure.
Absolutely.
Okay, thank you. Any other questions? It was great. Thank you very much.
Thank you.
Public comment. Is there any public comment on this one? Is there any public comment online?
No online public comment at the moment.
Thank you. All right. Is there any discussion on this?
I mean, it really sounds to me like an innovative approach. They have a need, we have a need. They both complement each other. The solutions complement those needs. So I don't know. I mean, I think this is pretty innovative. I'm all in favor.
So when I was reading this morning, I thought, isn't this interesting that Douglas County just left Tri-County Health, and we are now working with Elbert, and now we're looking at doing another partnership with more counties. So are there benefits or not? There obviously were benefits in 1967 when Douglas County joined Tri-County Health. And we know that a lot of those counties that Ms. Larson named have similar philosophical ideologies that we do. And so because of that, I think that there may not be the risk that we had with Tri-County Health, that the counties were different from each other. And so after I noodled through this, I think this is a good solution to a problem that both health departments are having, and I'm interested in seeing how this can start and how this can work. Thank you.
Any other? I will accept a motion in a second.
I have a motion to approve the request to develop a partnership with, is it Northeast Colorado or Northern Colorado? Northeast Colorado Health Department for WIC services.
Do I have a second?
Happy to second.
All right. We have a motion and second. All in favor, say aye.
Aye.
Aye. Opposed? Great. That really is a cool solution. I'm interested. I didn't ask, but I'll grab you some other time to talk about how you actually identified this solution. But all right. Let's move to general citizen comments. Are there any general citizen comments? Please, your name and the town that you live in, please.
John Fielding, Pinery. I would urge the members of this board to be leery of accreditation. And the principal reason for it is because accreditation allows outsiders to interfere with the operations of this board. If we had been accredited during a controversial period such as COVID, an accreditation agency could easily have been weaponized to try to force this county to do what other counties were doing, and not to be able to make the decisions that the county's citizens wanted. In other words, that this county would be responding to an accreditation board and not to the citizens. There's also the issue, I think, with accreditation of the creeping expense of this. I've seen this with the sheriff's office, where this was supposed to be basically a nice label, and now they've got full-time people who are doing the paper chase in order to maintain accreditation. I am not a huge fan of accreditation, and I suggest to the members of this board that the critical question is, how do the citizens of this county, not necessarily the employees of the department, but the citizens of this county, benefit from accreditation? With all due respect, Mr. President, I suggest that you should have reservations about this.
Thank you. Thoughtful comments. Thank you. Any other comments in the room? Any other comments online?
No comment, Mr. President.
Thank you. Are anything else from the board members? In which case, I'll accept a motion and a second to adjourn.
Move to adjourn.
Second.
All in favor, say aye.
Aye.
Aye. Opposed? Thank you all. Our next meeting is in September.
Yes.